Do you ever get numbness and tingling in your hands or know anybody else who does? If so, then you're going to want to watch and share this video. I'm Dr. Fox at Precise Chiropractic in Troy. I've been a chiropractor for over 12 years, and in this video we're going to cover 3 reasons why people get numbness and tingling in their hands and then some things that you can do about it. So one reason is because of metabolic disorders. So hopefully these metabolic disorders get caught a long time before they ever progress to having numbness and tingling in the hands. One of those is diabetes. So as our blood sugar levels rise, that sugar's irritating to the nerves, and then we end up getting numbness and tingling in our extremities. So typically it'll be in the hands and in the feet as well. Another reason that people get numbness and tingling in the hands is from compression at the spinal cord level. So the nerves that go into the hands come from the neck down, and we can trace them back up going to the area in the lower neck. That lower neck area, we have the C5 and C6 disc there. 80% of spinal degeneration at the disc level happens at that spot. So what'll typically happen is that disc compresses, it pushes out into the area where the spinal cord is, it irritates the nerves at the spinal cord level, and then we end up with numbness and tingling down both hands. The third reason that people get numbness and tingling in their hands is because of irritation at a nerve root level. So we trace those nerves back up, and again we're at that C5, 6, 7 level right there. And we can see these yellow nerves coming out from there. If we get dysfunction in the spine, those nerves can get irritated, and then you can end up with numbness and tingling in the hands. Typically with this, it'll be worse on one side than the other. So if you or anybody else is noticing these symptoms, some things that you can do to check to see if you have spinal dysfunction present is to look for the presence of a head tilt or a high shoulder. So typically you'll see that your head will often be tilted off to one side, or one shoulder will be higher than the other or rotated forward, and your hands might even be rotated forward when you're standing at your sides as well. If you can see any of the backs of your hands when you're just standing at a normal position, then you know that there's a little bit of dysfunction happening there. However, it is possible to have spinal dysfunction present without having a significant noticeable head tilt or changes in the shoulders. So what I recommend for anybody who's dealing with numbness and tingling in the hands is to come into our office and get a specific 3-point spinal exam. We're going to find whatever dysfunction's there so that we can help you with this problem. So our office number is 248-680-7200. So if you're suffering or you know someone who is, please give us a call and we'd be happy to help you.